And to us, the most important necessity became addressing the oxygen shortage. When it comes to optimizing oxygen usage, we can have three broad categories in which we use it. The first is personal oxygen concentrators, which is what most of these donations are all about, which means that you have these portable oxygen concentrators which are capable of delivering oxygen at a rate of 5 to 10 liters per minute, which is capable of supporting one individual patient either at a hospital or at their home, and ensuring that people with borderline hypoxia do not worsen much further and are able to be supported. The second, and this is also something that we are working on with our colleagues in the US, is these large hospital-based oxygen generators. These are capable of generating oxygen to the tune of 200, 500, or 1,000 liters of oxygen per minute, which means that for every 200 liters of per minute of oxygen that you have, you can support 40 hospital beds. So this is something, so for example, with a 1,000 liter per minute oxygen generator, you can support 200 oxygen beds and patients who require oxygen. The final point is on oxygen optimization, is on avoiding oxygen wastage. And we are working very closely with several research institutions, including TIFR, IIT Bombay, Stanford University, in ensuring that there is virtually no oxygen wastage, and to figure out ways where patients can be maintained on the same level of saturation with 50% of the oxygen actually getting delivered, which is again a method of conservation of oxygen. So when we first discussed this with Geetika and Naresh about how we could supplement the oxygen shortage in the country, we were very keen that we wanted to optimize the impact or maximize the impact that it came in. We were clear that this support would not be restricted only to the Tata Memorial Center hospitals, and wanted this to reach to the last mile of every center which was treating patients with COVID. And therefore, we reached out to our network of 200 plus cancer centers, which are part of the National Cancer Grid. And it's important to understand why we prioritize these over other hospitals. It's not that we think that hospitals which don't treat cancer are less important. They are equally important, are probably doing a phenomenal job in treating COVID as well. But the point to remember now is that with cancer centers, it is not just treating COVID. We need to ensure, we've done some studies which show that hundreds of thousands of lives more will be saved if we combine or continue cancer treatment along with COVID treatment.